Welcome to week 4. I've put together some slide presentations in week 4, 8, and 12 in the absence of a gradable assignment at that time. Just some slides to put together so that you can think about some of the additional nutritional principles and information that's out there. I'm going to incorporate that on exercise and weight management and some other, hopefully what for you will be interesting topics. So that as we get started here and navigate through this, this will be, again, something you view at your leisure. Again, there is no gradable assignment associated with this, but just something to enhance our learning on our journey along the way. So let's get started. So let's start with a nutrition facts label or some portion of it. What kinds of information are you interested in when you view something like this? The numbers or totals of fat in terms of calories for a 2,000 or 2,500 calorie diet. Are you interested in the amount of calories per serving, let's say? What about total fat or total carbohydrate? When I work with people with their weight management programs, one thing we talk about is calories count calories. And a label like this for the foods they choose will be an important way to proceed when they want to know exactly what they're doing in terms of the calories that they do consume. So this is a good start to get familiar with, and some of us have some experience with this, others very little. But if you've never thought of that, it might be a good chance for you to think about starting with something like that. Now, when we look at the macronutrients, and the carbohydrate, protein, fat, and alcohol as a cousin, so to speak, are those that contain energy. And I think what's interesting here is to note what the energy equivalency per gram is of each of these. We know that fat is more than twice in terms of energy potency than that of the carbohydrate and protein. So that when we talk about unlocking fat, whether that's something we consume in our diet or something that we store, it oftentimes is a difficult thing to do. It carries some real opportunities, so to speak, and challenges. But once we know we can unlock that energy, we know that it is a force to be reckoned with, so to speak. Particularly when we look at aerobic exercise and the actual energy source we choose for that, we know in the presence of oxygen, fat can be unlocked much more easily than without. So this is a good representation of when we look at the macronutrient, what are we thinking about in terms of the kinds of energy that each contains. I like this as a nice graphic representation of some of the simplification we need to make around vitamins and minerals. This can be a real complex opportunity and a complex challenge for a lot of people when they look at all the sources out there. But in a nice listing way, we can at least see in a graphic representation here what those vitamins look like and minerals in terms of their major classifications and some suggestion as to where it is we might find sources for those. So again, while we can pick up any pamphlets and we can go online and find resources for that, let's at least for our own purposes, or at least professionally, think about simplifying this for the individuals that we work with, so that there are those favorite foods that are healthy that contain the kinds of vitamins and minerals we're looking for without thinking that we have to be so elaborate. And sometimes that's the challenge for a lot of different people. Notwithstanding the kinds of challenges that we need to think about for those who have illnesses where we have to be really careful anyway about the vitamins and minerals that we do choose. Hopefully this helps as well. Here's something I thought you might find interesting to look at is this nutrition-related objectives from Healthy People 2010. What those targets look like for this program, and what are those current estimates for people trying to achieve this. So if we look across 6 of those important factors and dimensions, we see that there are some that are doing obviously much better than others, and there's some real challenges for this. So as we keep this in mind for the people we work with, again, or personally, how much of these, you ask yourself the question, am I trying to attain in my own nutritional balance? And am I close to the kind of target that I would like to see for myself? So as we create these little roadmaps for ourselves and others, sometimes when we quantify those targets and we can see real results, we know that there are a lot of challenges, again, and opportunities that lay ahead. Now here's a slide that takes a look at 3 really important components to nutritional excellence and overall good health. and that is some statements here regarding some appropriate approaches to diet, and those that also tell us a little bit about physical activity. So if we look at those two together, we know that those are a perfect coupling when looking at energy balance. And later on in the course, we're going to have a couple of opportunities, I think, to address this through some of the assignments and some of the case studies or patient profiles, where, as an example, weight management becomes an issue. And when we look at that, we can make some recommendations, again, whether that's to people we know personally or those within the profession. We then ultimately, it comes down to a matter of talking about things like, did the energy balance on one end, energy in, match that of energy out for physical activity? And that's such a critical point to make and a concept to understand that, at least here in this slide, we have some suggestions as to how that can be accomplished. So as a good basis for principles and learning from them, let's take some points away from this and some learnings and begin to apply those wherever necessary and appropriate. Now here we can also take a look at the concept that we often look at and think about with respect to people and their undernutrition and overnutrition. Let's go back to the previous slide and think a little bit about energy balance, and that when we take certain calories in dietarily, how can we match those to those complementary way for those calories out in expenditure. So again, we see energy balance here as being a real issue. So when we look in the middle and we see what we would think of as desirable nutrition, we know that we can fall on either end of that, and that would be undernutrition, and the nutritional status of the individual is really called to question here, and as opposed to those who may suffer from what we call overnutrition. And the example they give here is iron toxicity and liver cells and how they may be affected. So we can err on both ends, so to speak. So like our energy friends and our energy concept, let's also understand undernutrition and overnutrition can also play an important role, how the person proceeds along as they're trying to achieve nutritional excellence. Here's another representation from that model many are familiar with mypyramid.gov. Originated with really the 6 food groups. We don't see oils here specifically displayed. But here with the grains, vegetables, fruits, milk, meat, and beans, again we have another representation where we're told what those recommendations look like and where we can expect in many cases to find sources for those. So again, in a simplified form, we know that we have a nice opportunity here to glance across and find that as an example with a 2,000 calorie diet, we do have some recommendations for how many of those specific foods that we might consume in order to meet those requirements. So again, as we've seen in so many other cases when we're talking about dynamic equilibrium or balance or homeostasis across many health parameters, here's another wonderful example of what we can look for in major food groups and find those foods in a way that provide the kind of balance we need from caloric intake as well as nutritional support. And here again I've shown you really a full representation of what a food label or nutrition facts food label may look like. I think again when we look across much of the information that's provided to us, this gives us a lot of information to make some decisions about. Again, for many of you who have done label reading, and for those who are interested in having people look at labels for their own benefit, one thing I'm going to point out that can be somewhat misleading at first glance, that is, if you look at the amount per serving, calories 390, we often find people, at least in my experience, look at calories for 390 and they think that what they've purchased, that's what that container particularly carries. Well, what we need to do is to look just above that to see how many servings there are in each container, and in this case it says 1. So we would know that there is one serving that is packaged here. For those of you who read lots of labels on other packages, you may find that there may be up to, in some cases, 3 or 4 servings in a particular container. Again, it depends all on how it's packaged. So don't be misled, or don't have others be misled by the idea that when they do see the idea of calories there as they read it, that they think that's what they're necessarily purchasing in that specific package or container. Let's just make sure that we're identifying how many servings are contained within it. Here's what may be a slide that many people have some questions about, or at least with respect to the consumption of alcoholic beverages, and really what their understanding is with respect to food safety. Maybe this is worth a glance. Ask yourself the question, am I as up to speed on some of these things as I need to be? When by my own justification or by the questions I might receive from others, what are some of those guidelines that are being thrown around these days in terms of this? And we know that today, as an example with food safety, lots of habits prevail out there where people simply don't practice the kind of food safety that they need to practice. So let's be cautious with that, and let's be mindful of others that what they need to do is to, of course, clean their hands at all times and clean counters and the rest of it. But that's something that's often overlooked in a domestic environment. Now, whether we go into certain restaurants and we know that those guidelines are strict and enforced, at least we hope they're enforced to a great degree, this really does exist everywhere. But the other question oftentimes people have, just above that in alcoholic beverages, is it okay to consume? And how much is too much? So these are questions, obviously, that they need to answer with the guidance of their physician. But those are questions, again, that linger out there for so many. Okay, here's where we have an opportunity to look at some of the healthy snack ideas for children. So much attention, as you know, is being paid to these days to school lunches and school lunch programs, and what are packed within lunches when kids come to school. When we look at the obesity epidemic that is really ravaging our schools in younger ages, these are the kinds of questions that are often asked around what can we pack those lunches with and what can we provide. Now, we know the discussion and the debate is wide-ranging, and there's if not political, there are certainly economic considerations with respect to this. But here's a glance at just 20. I guess in my mind I would ask you, which others would you add to this? And how much in our schools are there educational opportunities and tactics in order to help not only the children understand what they're consuming at lunch and at snack, but what about those of the parents that at home are preparing those for the children themselves? There's no question that at this point, our opportunity to correct the situation and to begin to offer some hope for management of the obesity issue is one that will likely and certainly begin with the kinds of food and snacks that we're sending to school. We can talk about what's happening in the home environment away from that time, but what we have at school that we don't have at home oftentimes is the educational vehicle to offer explanation. Here's some current hypotheses around the causes of aging. And why include this in some nutritional discussion? I can at least point to I think very simply, to glycosylation of proteins. And we also know that we can have glycosylation of red blood cells and white blood cells. And when we look at the diabetes patient as an example, where high blood glucose levels may prevail, this causes a particular insult, whether that's to the cardiovascular system or, in the case of glycosylation of white blood cells, to the immunology of the patient, leading to problematic infections, let's say. So across the spectrum with some of these hypotheses, I think we have some opportunity to see that nutritional status will play an important role in the way the cell not only divides at a very, very elemental level, but how tissue prevails and how tissue withstands the insults of a poor diet, and how correcting that can go a long way to improving not only the immune system or the metabolics of the individual, but clearly their overall health. I like this slide for a lot of reasons. Looking for these guidelines when people are eating in their later years, certainly within the healthcare environment in the hospital and long-term care and other situations, So much attention, rightfully and correctly, is played to this. But this is also a case where we need to be a little bit more vigilant as professionals when we're talking about people who don't have the caregiver, don't have the family support that they necessarily need, and that when we're talking about assisting people in the choices they make for food when shopping or shopping for them, really becomes an important matter. So take a look across of this list and see what items you can come up with that are different from this, let's say, but share the same kind of quality for the people that we work with. How important it is to take care of our elderly, to make sure that they do have the nutritional needs met and that their food choices are what they should be for them. I just had a few more comments to make and a couple of thoughts around weight management, how much we hear about this. Again, many of our assignments in this course will be dealing with this question, whether that's a diabetes patient or whether these are people that are specifically interested in a weight management program for themselves. There's no question about it that today much of the success, along with much of the failure, seems to preside in those situations where people assume that they have good information, but really what they practice leads to their failure. So when we see people lose 5 pounds or 10 pounds and quickly regain it back, we know that there are certain principles at stake, many of which we are going to learn here together through our course of our 15 weeks, that will help them understand that. No matter your level of understanding of weight management, it clearly is that question that around any dinner table or around any casual kind of gathering with family and friends, that someone out there is trying to manage their weight in some manner. And if we are able to overhear some of those conversations or directly approached by it, we often hear some of those principles that are in practice by these individuals really do need some reworking. So let's take a look at just a couple of slides. I know your text is going to address this in a meaningful manner, but I had some thoughts on it as well, and I know that our sharing in the weeks to come, I'm sure, will provide some interesting ideas around how people can approach this very important matter. So here we have body composition, or the concept where we talk to people about what does the composition of your body look like. According to the ACSM, when we look at body composition, we're also looking at health from what we call muscular fitness. We also look at flexibility, and we also look then at cardiorespiratory fitness, among 4 major components to it, body composition being one. But what are we telling people these days around what a percent body fat is that's achievable and healthy? Today we know that we'd like to see people between 15 to 17, males anyway, and females between 20 to 24. In fact, those numbers are even a little high from some estimations. But that what we're accepting even is 18 to 19 or 25 to 29 respectively within those gender groups. And anything above that can be problematic. But I think a research and a look back into the comparative kinds of guidelines over the last 30 years will tell us that those numbers have shifted dramatically upwards over the course of that time. And how do we measure it? Hydrostatic weighing? That's expensive. What about bioelectrical impedance analysis? The same, time-consuming. We have to find the right environment for that. Or something more simply done within the health club environment, which would be the skin fold measurement, so that can tell us something about what my percent body fat looks like. The other matters we talk about are things like BMI and what we know from that. We know that doesn't tell us necessarily how healthy a person is from a body fat content by any means, but it really does tell us that what it's telling us is based on height, how much lean body mass do I suggest I have, and what is its relatedness to cardiovascular health, or the waist to hip ratio. Later in a minute we're going to talk about waist circumference. What does waist circumference potentially tell me? These are all matters for consideration when we're talking with those individuals that are asking us those questions around how much body fat should I be and whether we care enough about it. So to that end, there's lots of good debate and lots of good discussion out there that continues. Let's take a closer look at body composition with respect to two others that are measurements of what we call relative health with relationship to weight and all. And the BMI, the body mass index. Many of the studies out there today, most studies out there are getting away from weight tables and looking more at BMI as a measurement of whether someone is at weight, underweight, or overweight. It doesn't tell us in pounds, but tells us that index that if we have anybody over a 25 BMI, that it's telling us what that risk is for the person for the coronary artery disease and other health risk complications. So again, we can see lots of studies and recent studies rich with using BMI, but as I mentioned in an earlier slide, that the BMI can become problematic for those individuals who are in sports performance. We may actually have a very lean individual whose BMI is very high, so that doesn't work for them. But within a general population of people, it does. And of course, all the rage has been over the last several years, what does waist circumference tell me? And that the recommendations today, according to those who are involved in cardiometabolic disease and the metabolic syndrome, that we'd like to see women under 35 inches around the waist and men under 40. And that likewise, in like fashion, that tells us much the same as BMI does, that if we see those kinds of waist circumferences exceed those numbers, that we're talking about people who are at risk for developing coronary artery disease and having a cardiovascular event. Within my own practice, I have those who are very sensitive to the idea of weight, and oftentimes without frustrating people, because they oftentimes will look for more weight loss than they probably should, that oftentimes we look exclusively at waist circumference and see if there is some loss that way. Because while pounds are important to lose, we know that waist circumference will tell me that my risk for developing some kind of cardiovascular anomalies will actually be reduced with that reduction. So lots of good studies out there, lots of good information. The HOPE trial being one large cardiology study over the last 10 years that told us a lot about what we would expect from people whose waist circumference were either in the excess of those numbers or those below. So as we want to talk about plans for those who would want to lose those extra pounds, don't just diet, certainly. As we mentioned in our earlier discussion in our time together in this presentation, that we have to strike that important energy balance between energy in and energy out. And that word diet can cause all kinds of problems for individuals when what they really are seeking, probably in 75 or we think over 75 to 80% of cases, is calorie restrictive diets, and that they're really just starving themselves. And we wonder then, and we do know, that the metabolic rate of the individual is concomitantly lowered with those kinds of diets, so that ironically what may be happening is we may actually see people who end up gaining more weight than they do lose it if they put themselves in some starvation circles. So we don't just want to diet, we certainly want to balance that out with a nice program of calorie restriction that's safe and reasonable, along with, again, a program of activity and energy expenditure that does the same. So as we begin to wrap up our discussion, here are a couple of things to think about from the ACSM guidelines of most recent vintage when talking to people about losing that weight safely. That we wouldn't want them to go any lower than a 1,200 calorie diet per day on average. And again, as we make these suggestions again to people, whether that's personally or professionally, what are we telling them about the supervision of a physician here? We know lots of diets recommend going below, and if not recommend, that people on their own are making those kinds of justifications unwisely. And that when we talk about creating a negative caloric balance, that what we're talking about safely is somewhere between 500 to 1,000, and that would be a compilation, or that would be again a coupling of the energy we are reducing in terms of dietary intake as well as that which we are expending. And that weight loss should not exceed that 1 kilogram or 2.2 pounds per week. So as a last word on this matter of weight management and actually wrapping up our presentation altogether, um, lots of things, lots of approaches prevail today out there when people are talking about what can I do to lose this weight. And we know for a lot of people the specter and the proposition of having to count calories is just something that they want to avoid. In fact, what we've seen most recently, as you know, is that we're looking at serving sizes and people eyeballing plates and looking at rating a plate and the rest. And that we've gotten away from this simple quantification that a calorie will tell me. But there ultimately may be no substitute for it. And again, the weight management plan I use with individuals I speak with and the tools I use and have created, I have them carefully watch this, and I've seen with great success people lose the weight that is necessary because they have actually gone out and have done a good job in terms of what they take in as calories and what they expend. And when they strike that important energy balance at the end of the day, they may find themselves over the course of several weeks losing that 2 pounds per week, if that's their goal. And that when they look back and they've actually logged in those numbers and have found what did those calories that were either expended or taken in tell them, it's that very thing. And oftentimes those numbers are right on. So there are lots of different approaches that fit lots of styles for lots of different people. Just as a word from my end, I happen to think that calories do indeed count, so that for those who want to count calories, I think that can be met with a great deal of success. Hopefully you've enjoyed our time together in this presentation. We have 2 more to follow down the road, and we will be talking about issues, hopefully, that are meaningful, again, to each of us on a personal basis, as well as those that can enhance our professional status and our professional goings on. Thanks again, and we will be in touch soon.